trauma is the hottest topic in mental health. We have heard so much about trauma. You know, Shannae, when you and I started working in trauma, that was way before it was cool. Not many people talked about trauma. Why do you think it has changed so much and trauma is such a big topic?
Well, I remember when I was in graduate school and nobody mentioned the word trauma. In fact, we know that the concept of trauma really was not introduced until about 1980 with the diagnosis of PTSD in the diagnostic manual, the DSM-3. We know, however, trauma has been around forever. I mean, we can go back to Cain and Abel. Trauma has been with us for a very long time. But as clinicians, we really didn't acknowledge that it was the root of so many things. And so because of the Vietnam veterans that came back suffering from extreme combat trauma and rape trauma survivors as well, really were the individuals who led us to understand that there was PTSD. But that was in 1980, and since then, over the decades, we have had so much research that has demonstrated that trauma is not the rare event that we originally thought that it was going to be. In fact, trauma is everywhere. And we know from research that about 70 to 75% of individuals have suffered a traumatic event at some point in time in their life.
Yeah.
And we know also with the research, trauma is not just a psychological phenomenon. We've had wonderful researchers such as Bessel van der Kolk, who has taught us about the neurophysiology of trauma. We've got EMDR and brain spotting as some brain-based treatments. But we also know that trauma affects the body. And we have trauma treatments such as somatic experiencing from Peter Levine. We've got sensory motor therapy, which was from Pat Ogden. And kind of my heart is really looking into the complex trauma and complex PTSD that Judith Herman brought in back in the early 90s. And I'm wondering if you want to speak a little bit about that.
Absolutely, and I think one of the things that has caused our most recent increase in both the awareness and interest in trauma is the ACEs study. Almost all of you have heard of that. It's adverse childhood experiences and a really massive study longitudinally of how trauma impacts, especially those who experienced it early in their life. And that study, I think, also brought in and ushered in what we now know as trauma-informed care and the importance, because we realized that not only does trauma cause PTSD, but that many of those, and by the way, the 70% to 75% of people who experience a traumatic event in their lifetime, only less than 10% of those are really going to develop PTSD.
Exactly.
But what the ACEs study taught us is that at subclinical levels, trauma is still impacting people. And across all aspects of the person, it affects us professionally. It affects us in our relationships. It affects us spiritually, and it affects our bodies. Many of the health conditions that people go see their doctors for, from chronic pain to heart disease to diabetes, have real connections to childhood trauma, to adverse childhood experiences. And that's one of the reasons that we now see this big push, not just for mental health professionals, but for anyone interacting with people to be trauma-informed, and the need for trauma-informed care.
Well, and can you please explain that? Because I know a lot of people are talking about trauma, but they don't really understand what is trauma-informed care. So I would love for you to explain.
Yeah, what is trauma-informed care? First of all, there is a quote, and this is not my quote, it's from Dr. Bruce Perry, but I think it really is the essence of what being trauma-informed is. That when someone does something that doesn't make sense, when they behave irrationally, and if you watch the news on any given day, you see a lot of people doing things that we go, why in the world would they do that? And Dr. Perry said, instead of asking, what's wrong with you? We should be asking, what happened to you? That's the essence of being trauma-informed. And I believe we would really transform our world if our doctors, people in the legal system, law enforcement, teachers, and educational systems, when people behave in ways that don't make sense, that we would begin to think through that trauma-informed lens, that maybe I need to get them help. Maybe I need to get them to a trauma therapist. And so, Shannae, what I want people to know is that being trauma informed, while important for all people helpers, certainly everyone in this room,
Yes.
it doesn't mean that if you're trauma informed, that you are a therapist who can treat trauma, and that we really need to make sure that the first step after we have screened and said maybe this person has a trauma problem is getting them to a mental health professional that really is an expert in trauma.
Well, and that's one of the things, because I've been treating trauma in my private practice for over 25 years. And I know back in the day when I would have individuals suffering from trauma and I would want to send them to a physician or somebody, and I would have to call the doctor and say, this individual has complex trauma from their childhood. Can you please be sensitive? And they didn't even know what I was talking about. And so we're grateful for that trauma-informed care. But as you said, I have run into some difficulties of individuals who say they're trauma-informed, who try to do trauma treatment. And you're absolutely right. That is very critical that we actually refer to clinicians like the two of us who are well-educated and trained in doing the trauma treatment. Because if you don't have that education and training, you can actually do more harm than good.